Hi, my name is Robin Kaur and my student ID is 222 01084. Sharing my screen. Here is my topic. My topic is case study 1 breast cancer, which is Amara's case study. And the first topic is we have to explain what the topic is and the risk factors. And I'm going through with this. Firstly, I'm going with the topic. Topic is breast cancer and the risk factors. Breast cancer results from genetic changes to normal cells that alter the process of cell division and multiplication. Amara's diagnosis entails stage 3 invasive ductal carcinoma, IDC. IDC refers to breast cancer that begins within epithelial cells within the lining of the milk duct. It is said to be invasive if the abnormal cells cross the milk duct lining into the surrounding breast tissues. At the molecular level, the genetic range referred to above affects the functioning of genes, particularly in repairing DNA that has been damaged. For instance, the BRCA1 gene in Amara leads to the creation of protein that repair the double strand breaks in DNA and stabilize genomic integrity. However, the cancer progresses and expands in size. The cancerous cell become invasive and start invading surrounding tissues through their spread via the lymphatic or blood system. This explains why Amara had cancerous cells in the axillary nodes and chest wall as shown on her biopsy results. Stage 3 involves extensive spread into axillary lymph nodes, especially those located either above or below the collarbone and in the chest wall. The presence of pain, mass, and breast discharge are classic symptoms of breast cancer. This occurs because of the disruption of the breast tissue structures by the tumor and its interference with the nearby ducts. And the factors are genetic risk, BRCA1 gene mutation explains. Seabrook explains that major contributing factor for Amara's condition in the presence of BRCA1 mutation. The BRCA1 gene mutation causes individual to be predisposed to breast and ovaries cancers because it reduces their body's ability to fix DNA damage. Second is age. Breast cancer risk is higher in older women. Amara was diagnosed early in her life. The occurrence of early breast cancer is usually linked with the genetic mutation like BRCA1. Third is reproductive and hormonal issues. It states that Amara has been pregnant several times, which might protect her from breast cancer, but hormonal changes in her body contribute to overall estrogen procedure. Last is lifestyle. Lifestyle is like how she is, maybe a reduction of physical activities in her life, or it depends on the meals, the food that she is having. And next we are going with the nursing interventions, pharmacological and non-pharmacological. One major non-pharmacological management. First, pharmacological management option that should be considered is that of administering analgesic using morphine as one of the drug used based on the World Health Organization analgesic ladder. Morphine is indicated in cases of moderate to severe pain related to surgery and cancer. The drug works by acting on opioid receptors in the brain to reduce both pain sensation and psychological distress in patients. Cancer Australia states that Amara's condition seems to have some neurogenic pain. Morphine alone would not be adequate. A combination of analgesic and other adjuvant therapies is recommended to address various pathways of pain. Non-pharmacological treatment surgery would be repositioning therapy with arm support and relaxation techniques. Good positioning relieves physical distress to the surgery and minimize the pressure on the nerves affected, especially because of Amara's problem with her axilla. Arm support through the use of pillow will provide more comfort and relieve her from pain when she rests. Relaxation through deep breathing will minimize the pain and relieve stress because it calms down the sympathetic nervous system. Um, Donaldson it states that to start with proper wound and drain management is crucial to prevention, infection, and facilitating healing process. Amara has two drain in place. Sheet drains are such drains are widely utilized to prevent seromas that may form after mastectomy surgery. The nursing team must conduct an assessment of the wound area to rule out any signs of infection such as redness, swelling, and warmth. The amount of fluid draining from each tube needs to be monitored daily. Nurses are expected to evaluate the color of drainage and determine whether the amount has increased. A septic technique is crucial when managing the dressings to avoid any infection. Finally, it is necessary to educate the patient in Amara, require teaching about drain management at home, recognizing signs of infection and consulting a doctor if needed. It is crucial to plan for Amara's discharge given by her busy schedule. This is how we are educating the patient for the post-operative. Secondly, pins and needles in the axilla of Amaras imply nerve irritation or damage and usually involved the intercostal brachial nerve following axillary node dissection. In terms of nursing interventions, nursing assessment needs to involve the use of pain and sensory assessment through validated assessment instruments to differentiate the nociceptive from neuropathic pain. Possible interventions could include the use of pharmacotherapy in the form of neuropathic agents and non-pharmacological interventions such as positioning and gentle range of motion activities and referred to physiotherapy to prevent the possible complications such as chronic pain and limited upper limb function. Prevention of complication is crucial since mobilization without neglecting protection of the surgical wound site prevents lymphedema that could occur considering lymph nodes have been affected. And then we are going post-operative education and management, how we are teaching our patient. Surgical wound and drain management is another significant area that will need to be educated. Amara needs to learn how to properly handle her two drains and drains fluid from them, measuring the fluids and identifying any signs of infection like inflammation, heat, fever, or foul smell. With respect to the fact that she is a mother of 4 children, it is advisable to use a demonstrative and written mode of teaching. In addition, educating her on activities that she should avoid facilitating quick recovery is paramount. She should not lift too much weight nor make frequent arm movements on the side where surgery was performed to minimize the stiffness, hence preventing lymphedema. So educating on the psychosocial and genetic aspect is equally important in Amara's case since the BRCA1 gene mutation has been confirmed. She needs to know how this may affect her cancer risk in future and even that of her children. This will ensure that she seeks genetic counseling, makes better decisions regarding surveillance and prevention. Lastly, explaining that an interprofessional approach is necessary to cater for her multidimensional requirements. This involvement of an oncologist will direct treatment plans like radiotherapy and hormonal therapy. A physiotherapist will help treat her shoulder injury. Lymphedema management by an expert can help monitor and prevent complications. Seeking help from a best breast cancer nurse can help her continue receiving proper nursing care and psychological support. Considering her caregiver duties, social work intervention is mandatory to gain access to necessary community services and financial resources. These strategies are designed according to Amara's condition and the surgery outcome, which is for her safety and comprehensive recovery. Thank you so much. Here is the references. Thank you.